In our final installment on matters concerning sexual health, today we're focusing solely on female sexual health and some of the things we need to consider to manage this. Joining me for the discussion is Dr. Mark Opperman and Sister Elize van Aardt. Welcome to both of you. Nice to have you back on the couch. It's been a while.
It has. Thank you, Michael.
Pleasure. Now, Mark, I'll start with you. I mean, women of a certain age are finding inconclusive health challenges. What are you seeing in ladies that are walking into your clinic?
We find women 40 and over walking into the practice and they're complaining about the fact that they've been from doctor to doctor and no one can find anything wrong with them. And when we look at their biochemistry, there is nothing wrong on the biochemical markers. And this is a horrible period in a woman's life. It's the perimenopause.
Right.
It's where things start going wrong, and you know what? No one is pinpointing it. We find that it is, they lose a little bit of memory. They start with night sweats. They feel cranky, irritable. A loss of sexual desire and libido. Now, libido being sexual thoughts and fantasies. We're going to do a podcast one of these days, and the topic is, I love my husband, but I can't stand him. It was coined by Elize.
Yeah.
And Elize, it's something that you went through. And it really is that nondescript symptoms of, you know, my life is not my own anymore.
Yeah.
I want to add what Dr. Mark is saying in the sense that there's nondescript symptoms,
Right.
and then you get your descript symptoms when you go into your perimenopause and menopausal time of your life,
Yes.
which we don't want to call a condition because it's natural. You go
Yes.
through there. The one thing is they complain of weight gain around the abdomen and hips and upper thighs. They complain of more hair in their face, for instance. From my side, I can relate to that because I've been there,
Yes.
done that,
Yes.
and I can say, but it's okay. We can help you with different treatments, etc. What we do differently is we look holistically at the patient.
Right.
Biochemistry, as well as physical, as well as other symptoms and emotions and all of those little thingies that we look at.
Mark, maybe I can ask you, is there any sense in trying to treat one thing? Surely you can't skip the holistic view because it's all interconnected.
You know what, Michael? If you do a symptomatic treatment, you make it better for a short period of time. And it's a short period. And then something else starts popping up. I always tell my patients, we have to balance hormone systems. Now, if we look at the steroid hormones, for instance, steroid hormones come from cholesterol, but they include testosterone, estrogen, your thyroid hormones, adrenal glands, adrenaline, noradrenaline, cortisol. So, you know, they all affect one another. It's this river that divides into little streams. At some point, they all meet again. If you dam one of these streams, it has an effect up as well as down the river.
Okay.
And you know what? You flood upstream and you have drought downstream. Eventually, all that water makes its way back into the main channel, and that's where we find difficulties. So there's not one symptom. You have to treat the patient holistically. It's very difficult, if you're not a specialist practice, to manage all these things. Therefore, in my practice, we are two that deal with each patient.
So what can somebody expect if they come and see you?
We do a physical examination when they come in, which includes a pap smear checkup if their mammograms is on time, etc., etc. Then from there, we do a tests, lots of blood tests, and we have a consultation where Dr. Mark and I sit and discuss the treatment plan going forward for these patients. I think that is our approach that works well. And usually in that consultation, they forget to tell us certain things. They forget to tell us that they have urinary incontinence when they cough and sneeze. But when we ask that pertinent questions, they say, oh yes, I remember that now.
My consultations, Michael, with my patients are usually about an hour, a new patient, because you have to be in control of the condition, not me, the patient.
Yes.
The only way that we can do that is by having the patient understand the process, why it's happening, what the symptoms mean for them, what the biochemistry has to tell us, and how that biochemistry relates. And that takes time. So most of the time that I spend with the patient is about educating them to become self-aware. And when you are self-aware, that is when you can take control.
Okay.
Because 99% of what the outcome is determined by is what the patient does at home.
Right, right.
And that's taking your medication as prescribed. But being aware that certain things can happen, this is the effect of the medication or not.
Right.
What we do is we bring our patients back once a week for the first 4 weeks. Our patients that are distant patients, we talk to once a week. And I have to defend my colleagues. We do not have time to do that. I'm very blessed because I have a specialist clinic.
Yes, yes.
So there's one thing that I would like to touch on. You know, as women progress through menopause, their health changes dramatically. We have, where estrogen is concerned specifically, a 15% jump between premenopausal and postmenopausal where cardiovascular health is concerned.
Very interesting.
Estrogen protects us from cardiovascular health in both men and women. The moment that estrogen starts declining or we stop the production of estrogen, women has a significant jump in cardiovascular disease, and this is heart attacks and strokes. 1 in 10 women will suffer a cardiovascular event, either in the form of a heart attack or a stroke, after the age of menopause. And this is significant. We need to be cognizant of going through menopause, what the symptoms are. Elise, you've experienced this before?
Yes, I have.
You always say menopause is like PMS on steroids.
Absolutely
Yeah.
correct description for menopause.
And I think you're not prepared for it.
No,
you know?
you're
Nobody
not
prepares you
prepared
for
for
that.
No, and you read up about it, but you don't realize it's so subtle, that changes that happens with you. It's an awareness that we would like to create and treat or manage for these patients.
Absolutely.
Yeah.
And Mark, for ladies watching who would like to get some consultations or some advice or some treatment on the experience that they are going through, how do they get in touch with you?
The easiest is to find us on our new website. We made it quite easy, by Dr. Mark.
Okay, fantastic.
By Dr. Mark. Or call us in Johannesburg, 010-824-1393, and we will take it from there.
Fantastic. Well, Mark and Elise, thank you so much. Lots of great insights there, and hopefully a little bit of hope for some ladies out there who might be struggling at this point in their lives. So wonderful to have you with us.
Always
Thank you
a
for
pleasure.
having
Thanks,
us.
Michael.
A great
Thank
pleasure.
you.